The Uganda National Population-Based Tuberculosis Prevalence Survey, carried out between 2014 to 2016, revealed that 89,000 people get TB every year. The rise in this figure proves to be a threat to the people who are determined to fight the highly contagious disease. However, USAID and other civil society organizations carried out a survey between January and December 2018 in 3 towns, including Kampala, Mukono and Wakiso. The survey revealed that in Kampala, 11,212 people were screened and 352 were diagnosed with TB. In Wakiso, 301 people were diagnosed with TB out of 5,108 who were screened, while in Mukono, 62 were diagnosed out of the 958 who were screened. The survey results suggest an increase in TB prevalence in urban centers.
In the first year of implementation, the project has discovered that TB is silently ravaging the urban communities of Kampala, Wakiso, and Mukono, with more TB patients being found in previously overlooked settings.
In a recent random survey conducted in the New Tax Park in Kampala, 22 people were diagnosed with TB. This has caused concern among people fighting the disease since TB is airborne.
For TB, this is a very high number in one location, given that it is a highly infectious disease. These findings highlight how close TB is to each one of us.
What this says is that imagine a scenario where each of those 22 actually got into a different taxi, and each of them actually coughed in one of those taxis. So from the 22 that you have, you're potentially going to have another 22 cases.
According to officials from the USAID Defeat TB project, out of every 100 people with TB, 4 don't know that they have the disease.
Has laid out a strategy to have treatment observed throughout the 6 months of treatment. So that once those are treated, then we curtail the risk of additional new cases, but also we are able to prevent the emergence of more complicated forms of tuberculosis.
They also say that increasing resistance to TB drugs among some TB patients means that the cost of treating the disease will go up.
It is much worse for a patient with a drug-resistant TB. It is much more expensive. And these are resources that would probably have been channeled into other development activities, but when we have a lot of TB in the community, we are going to be channeling a lot of resources into treating TB.
Ahead of the World TB Day on 24th March, health officials are calling on people to take charge and help in the prevention and wiping out of TB by 2030, especially by going for screening and adherence to treatment by those who are diagnosed with the disease. Juma Kiria, NTV.